Ladies and gentlemen, my name is Subrata Sarkar. I'm a mechanical engineer working in manufacturing industry since last 22 years. Today I'm going to discuss the topic personality disorder. Let's first understand what is personality. There are three components in personality. One is the heredity, another is the environment, and the third one is the situation. What is your personality today? It depends on these three component only. And that in many definition of personality it says that personality is a dynamic organization. That means not necessary to be fixed what is today. So it depends on the situation and the environment, it got changes in terms of your behavior, thoughts and feelings. But there is one component in personality, that is flexibility in terms of change depending on the situation, your adaptation capability. Sometimes with the many people, it is you can find it is absent actually. What they are doing today, they are they are very much rigid. That pattern is their mind, that is rigid, not changeable. That actually directed towards personality disorder. You know. So personality disorder is basically, this a pattern got rigid in your mind. Actually, it's not get changes, and not only that, which results in some psychological pain with that individual and the many people surrounding him or her. Now, there are a few points in personality disorder. Personality disorder you won't find with the children, like 5 years, 6 years children. That's not a personality disorder, because at that time personality is just getting developed. So personality disorder you'll find at the beginning of the adulthood of the people. Actually, what they this changes comes actually in childhood. That results or reflection is giving. And the second important point for personality disorder is there are many other disorder. Personality disorder is the one of the toughest disorder which got treated by medically. It is very difficult to treat by this clinical or medical process. It is this, what I mean to say is very severe actually. This personality disorder, treatment is also very difficult. Third point is, the person who has got the personality disorder, in most of the cases, he or she doesn't know that he has got some disorder, or she has got some disorder. And third one is, surprisingly, 10 to 13% people has got personality disorder. On an average, you can say by out of 10, 1% has got the personality disorder. There are many different types of personality disorder. There's 18 different variety or category of personality disorder. But that will be there with the people. At least 10% people has got this. I'll show some visual. You can see this picture. A person is cleaning the floor of his room. What is cleaning with the toothbrush? That is the giant of the task. Because he wants to see that his floor should be perfectly clean, very much clean. Do you think this is normal? Another picture I'm going to show you. There are people, if some grass is in the garden, and if he or she finds that some grasses looks different or grown much at a higher rate and it is higher than the other grasses, they don't like this, dissimilarity. They immediately goes and cut the grasses. So they are, over perfectionist actually. This is a symptom of personality disorder. But which type, I'm asking, which type of personality disorder is this? Another also you can see in this picture, normally we serve the fruits, a different fruit cut, mix and we give it on the plate or something. This is the normal situation. But many people, they don't like when you are giving all fruits or mixing. They rather prefer this one. You will give the all different fruits in a different segment. There's a different orientations. As I said, the 10% people like this type of, out of 10%, 1% like this type of things actually. This type of personality disorder is called OCD. obsessive compulsive personality disorder. There are some special feature of this. Like actually, this type of people, they are very much fixed with some rules. There are a lot of rules in their life. Actually, they create like when they goes to offices, even they sit on the chair, they like to see their mouse is right place, their desktop in a certain angle. Everything should be position. Otherwise, they don't feel comfortable. Actually, you know and also they are over conscious actually, and sometimes in our offices or homes or anywhere, some unproductive or not necessary things are kept actually, which are not useful. They don't like to these things to be, until they remove those unnecessary things from the place, they don't feel satisfied, or rather they feel disturbed actually. So these are the some symptoms of the person who has got this personality disorder, like obsessive compulsive personality disorder. Now I'll show some other photographs. You can see in this, a person is calling over phone and seeing something through her blind. And also here you can see this picture. Similar actually, in this picture also you can see. So always there is a, what are you going to find actually, this and three pictures. Actually they are a little bit, always suspiciousness is there, always doubtful, unreasonably doubtful. There is no reason for doubting, but still they are doubtful actually, and they are and this type of persons are always feel that there will be some attack to them, or this this type of unnecessary things they will find if they see some pictures, and after that they will get some feeling that whether some negative effect will come with them, or like that. So this is the some symptom in this personality, which is called paranoid personality disorder. And you can see some other set of pictures. Can you guess which type of personality disorder is this? Or you can see in this picture. From both the picture, you can one thing is common, that this people are little bit out of the group actually. They don't get very close to the people. They're always what I mean to say, they don't have good close friends, and they don't like actually very close relationships. They are always uh, actually they have got a fear of criticism or something, so they don't get into the group of the people, always isolated from the group. So when this intensity is increased, then it's converted into disorder actually, which is called schizoid personality disorder. So these are the actual basically characteristics. As I said, that basically they avoid the group of people actually, and they don't like the closeness with the people. So these are the things actually. Now I'll show another categories personality disorder. You can see what you can see here. One person has got a lot of muscular, that you can say this is an imagination. So in different roles, so there is a, every time there is a change in the personality. And the second picture also you can see the person has got some mood in some time, and immediately got the there's a change in the emotions or mood. It's not stable actually. Moods are not stable. So this is another personality disorder, which is called borderline personality disorder. This is basically this is the instability in their relationships is there, and this personality is very much dangerous actually, because their emotions got so much of there is a changing. They this sometimes it goes up to the extent of suicide. So this very critical actually, rather I can say. This is called borderline, as I said. I'll show another set of photographs. You can find some correlations between the photograph. This is one category that you can see one person here and another person here, and the third image is like this. So what common is that this is actually called histrionic personality disorder. Actually, here, you know, this type of people always like to be the center of attention. If the other surrounding people don't look at them, they feel very uncomfortable. They you know, they inappropriately dressed up in such a way that they find themselves very much attracted among the groups or people. Actually, they want to get the attention of the draw attention of the people actually, and if they don't get it, then they feel very uncomfortable actually. And so this is basic, and whatever they'll be talking, they're always talk to impress people actually, the impressionistic talking always, you'll find that. So these are the things actually. And I've discussed a photo of a personality disorder. There are many other types which you'll find in in the next video. I'll share definitely this other type of personality disorder. There are basically 10 different types. Now the important point is, as I said, it can be recognized in the early adulthood. So if you have, if your children, so like, your children, so you can notice those, if there is any disorder or something, and how it can be, is handled actually, and whether really there is a disorder or not. This is very important, and it can be, and there is nothing actually, as statistical and medically said, 10 to 13% people have any type, some or more type of personality disorder. So you cannot, avoid it actually. It is with most of the people, as a major category of the people, and different. So, but it's better to know that if you know it, then it will be very easy to handle the situation. And surely, and our next video I'll discuss that why this personality disorder comes actually, and what is the solution and how you can get rid of. As I said, this personality disorder is very difficult to treat by medically, because it's one of the toughest disorder which can be treated by medically. So by understanding from your inside, and accordingly you can take these actions, or the way it can be, you can change or come out from this situation. I'll discuss in the next video. Keep watching. Thank you very much for your attention.